Welcome to HiNZ 2018. I'm Pat Kerr, and I'm here today with Jerome Galbrun. Jerome is head of marketing for the EMR business in Philips, based in the Netherlands. Now, you gave a talk on the next-generation EMR. What does next-generation EMR mean?
Well, the next-generation EMR is really a very strong concept that Philips is currently promoting in New Zealand and in different markets in the world. You have to consider that healthcare has been in the past, and unfortunately today, still a very fragmented activity where you see professionals dealing with patients much more on a kind of episode type of activities. So next generation EMR will really allow professionals to work together by connecting data during those different episodes. So let me give you an example. You are a patient and you come to the hospital for a specific disease. Well, the next generation EMR will connect this information and start driving actionable insight for the medical professional doctors looking at your case. Now, you come back again to this hospital with another disease. The next generation EMR will make sense of this new episode and maybe will start making correlation with your previous disease. So all those elements will drive what we call precision medicine, which is basically using the data in order to better give actionable insight for the doctors, nurses, to provide you with the right treatment at the right time.
So in addition to being just recording what has happened, it's doing some analysis, applying some artificial intelligence, whatever, to that patient's record?
This is totally correct. This is totally correct, Pat. So from static information, we are moving much more into the knowledge space, where basically those next generation EMR are making sense of data and giving then additional insight to the doctors. Mm-hmm. And I want just to give you an example. You see those next generation EMR being much more patient-centric and giving much more information as well to the patient. So there is a second highlight with the next generation EMR, which is the empowering of the patient. So patient wants to be more and more engaged during their care cycle, and they want to know more, and they want to basically even interact more with the physician in order to better understand the treatment, to better comply with the treatment. And all this activity between what is happening in the hospital and what will happen at home is basically one of the key characteristics of the next generation EMR, is really to make the bridge between what is happening at home and what is happening at the hospital.
So it will be a source, a central source, one source of the truth, that's now available not just to the providers, but to the patient as well, depending upon what's needed.
Yeah,
is that
so
right?
You are totally correct. And it's not happening tomorrow, it's really happening today. We have already implemented this next generation EMR in different hospitals. And you see that aside from giving much more precise information to the medical professionals, and having the patient engage much more, you see a third level which is very interesting, which is what we call population health management, by which basically you collect so much data about your patient and then the population that then you drive very strong insight about how you can better treat this given patient. Let me give you an example. You come with a medical condition, then those next generation EMR are able to compare your case with similar cases and basically help the doctor to provide maybe the best treatment in your particular case based on the learning from all these different populations.
So you mentioned it's been installed in hospitals. So what is the scope of the EMRs that you've been implementing? Does the primary care records, are they brought into it, or is it just from the hospital?
So at this moment for New Zealand and as well for Australia, our plan is to focus on acute care, so EMR in the hospital. And why that? It's because this is where the most complex clinical episode take place. So we do believe that we will need first to handle this complexity of data by using the next generation EMR. And then moving forward, we would like to start reaching secondary care and primary care.
So is there a distinction in what you're looking, the electronic medical record versus the electronic health record? Or is that just semantics?
No, it's more than semantics.
Yeah.
It's a little bit different. Usually, in the terminology, we tend to keep EMR, electronic medical records, much more in the acute care setting, so in the hospital, whereas electronic health records tend to be a level up of aggregation of data that goes beyond what is happening in the hospital, but including family history and even what is happening with your general practitioner and some other sources of data affecting your health. Now, we do believe that Philips will be a possible solution provider in this space that we call health continuum. So Philips has not only an EMR solution dealing with acute care, but we have as well a set of different solutions that really help providers, not only in the acute care, but as well in the secondary care and primary care, to have really and realizing this health continuum.
Some of the experiences that we hear international with trying to implement a national EHR are pretty legend, aren't they? And there have been some failures. You look at the National Health Service in the UK and so on. So where do you see, in terms of rolling it out, what some of the biggest challenges are? If you're starting with the hospitals, but in terms of the rollout, what are the biggest barriers or challenges to actually make it happen?
What is very interesting in your question is that you have already a portion of the answer, in the sense that some of those programs has been failing in the past because the foundation were not there yet. A critical foundation is usually starting with acute care, because this is where it's the most complex medical records that are captured for a given hospital and for a given patient. Now, imagine that you start having very strong acute care settings, then I would say handling such a complex level of data, it's a little bit easier than to broaden up the scope of data gathering rather than starting from, let's say, a primary care setting. So I think there is few key drivers to consider. One is, of course, a very strong foundation in the hospital, in the acute care setting. I think there is maybe a need of alignment of incentive in terms of having, all the different players agreed on the common goal, and not trying to defend maybe some specific approach. And I think there is a third element which is very important, is that, and this is going to come more and more, is really this notion of patient engagement, where usually those programs have been excluding the patient. And at the end of the day, people will adopt the technology, will adopt, all those healthcare informatics solutions, as long as it really resonates for you. And I think if you start considering those solutions much more as patient-centric solutions, then you will have a much stronger adoption, not only by the provider, but as well there will be a push, positive push, to adopt those tools by the patient as well.
So how does the EMR, the implementation of the deployment, fit? Let's say we go into a hospital and we've got it, but they've got lots of other systems. They've got the pharmacy systems, they've got the booking systems, they've got all kinds of other systems. And how does that integrate with the other systems?
It's a very good question, because here this is really where you see the difference between conventional EMR and next-generation EMR. Conventional EMR tend to be much more rigid and closed system, whereas next-generation EMR are much more open for making a seamless integration with sub-IT systems that exist in order to basically get what we call a best-of-suite for the hospital. So rather than having a constellation of best-of-breed, departmental, niche solution, we do believe that the next-generation EMR should be those kind of best-of-suite, but still open in order to allow the exchange of data between different instances.
Explain to me again, so the difference between best of suite and
And
best of breed. Yes.
Well,
I hadn't heard that way of describing it before, so what does that?
Yeah, basically it's really the challenge of an hospital CIO today, where, you know, any specific department in the hospital has to deal with very specific workflows. So if you are an emergency department, you tend to have a specific way of doing the triage, because it's really a question of life or death. But then when you move this patient to, let's say, the cardiology department, you will have a different workflow. So you have been, in the past and still today, some very successful, what we call best-of-breed / departmental solution, dealing with only this specific workflow in this specific department.
Yes.
Now, this is very good for this department, but when you look at the overall hospital, you may say, I'm losing here a consistency. It's two different systems. Maybe those two different systems don't speak to each other. So then you will have to make all those connections between those systems, which tend to be very, sometimes difficult, take times. Now you have another approach, which is what we call the best of suite, which is a possible open platform dealing with electronic medical records that still deal with the entire information within the hospital, but still make a very strong point of dealing with those specific workflows. So a best of suite will have a specific workflow dealing with emergency department. A best of suite will have a cardiology flavor, will have an oncology flavor, in order to serve the specialties. Interestingly enough, in New Zealand, I think there is not currently any solution that can possibly claim this space of best of suite. And this is where Philips would like to possibly bring this next generation EMR into New Zealand, because with our current solution, we definitely have here a best of suite.
Fascinating. And Jerome, thank you so much. I really wish you the best of luck. And thanks for visiting New Zealand, and have a safe trip home.
Thank you, Pat. Thank you very much for your question.
Good, thank you.